Hello everyone, welcome back to my channel. My name is Dr. Chandus, I'm a consultant public health physician practicing medicine in Nigeria, and today we'll be talking about what to do before, during and after getting a COVID-19 vaccine in Nigeria. If this is your first time joining my channel, please remember to subscribe to this channel and hit the notification bell so you do not miss any of my video updates as I upload them. If you are a returning subscriber, thank you for joining me once again. Please remember to like this video and to share it with as many who you think may benefit from this video. The first tip or thing you should know before getting the vaccine is to learn about the different vaccinations that you have in your environment. In this context, Nigeria. Like I said earlier on, Nigeria has received doses of Moderna and AstraZeneca vaccines. So it means that it's important that you read up these vaccines, know what to expect, know the types of the vaccines, and familiarize yourself with the type of vaccines. It's advised that you do this by looking through recognized and authoritative sources of information, places like the NCDC website, the NPHCDA website, CDC website. These are authoritative and verified sources of information concerning the COVID-19 vaccine. So before you come into the facility, please remember to look through the vaccines and to understand how they work and everything else about these vaccines. The second thing you should do is to remember to sign up or to register for the vaccine. In Nigeria, before you come in for vaccination, you are advised to register at a site that is close to you and to keep the SMS that they will send to you close to you, and do this before you come into the facility for vaccination. Another important thing to do is to prepare what you will need for vaccination. This might seem like it's not important, but this is really important. The first most important thing is to remember to wear loose-fitting clothes, clothes that can allow your arm, because you're going to be giving the vaccine on your upper arm. The next thing you need to prepare is the SMS containing the information that you were sent, because after registration on the website to get the vaccine, you will be sent an SMS. So it's important to keep that SMS close to you and have it available at all times. Also really important is to have your face mask close by, because you'll be meeting a lot of people, and it's important to also, even though COVID-19 measures are, applied at such places or are adhered to at such settings, it's important to still prepare by having your face mask to keep yourself safe and to keep the health workers you'll be meeting safe. So have your face mask worn and with you, not just with you, have your face mask on at all times. Prepare to have your sanitizer, get your sanitizers, use them at all times. Remember to socially distance and remember to be really patient. The next tip is for the question that I get asked quite a lot of times, quite often. What if I develop COVID-19? Do I need to come and get the vaccine? It's a straightforward answer. If you develop COVID-19 and you had already registered for the vaccine, you would have to place this on hold. Call the facility ahead to let them know that you have now become COVID-19 positive, or you think you might be positive and going for testing. This is important because you do not want to put those you'll be coming into contact with at risk. So usually it is advised that you stay, self-isolate and wait till about 14 days after your last symptom or 14 days after you tested positive to come in for the vaccine. Taking the vaccine when you are positive does not have any positive or beneficial effect. So it is better to wait and get well and then come into the facility for COVID-19 vaccination when you would have recovered and you will no longer be a risk to the persons that you will meet. So the next set of tips is for what to do and what to expect when you get to the vaccination facility. So the first one I would say is like a repetition of some I've said before. Remember to keep your face mask at all times. You may be asked, so that it doesn't look embarrassing, to please keep your face mask and to wear them on. So before you go there or when you get to the facility, keep your face mask on. Keep your sanitizers within reach and remember to always socially distance yourself. The second most important tip for the vaccination facility, or for when you get to the vaccination facility, is to be patient. In fact, this is quite a problem at these facilities. You'll find that people want to be attended to now. Well, Remember that there are a lot of other persons, and there are probably persons who got there before you, and therefore service is offered on a first come first serve basis. So please be patient. When they ask you questions, politely answer them. Nobody is there to fight with you, or nobody wants to hold these vaccines. But please remember that you have other persons there who equally want to be served immediately. So please be patient and answer your questions. Do what you're told to do. Usually there will be a crowd controller or a supervisor who directs people through the different points and tells them what to do. So be patient and listen to these persons, as they are there to guide you and they are there to help you to easily assess and go through all these points successfully. So after the manual and digital registration process in the facility, you will usually be directed to the health worker who gives the vaccine. So most of these COVID-19 vaccines, irrespective of type, are given into the upper arm. So prepare, be calm. I know most people don't like injections, but just remember that it's a tiny prick that will give you lifelong protection against COVID-19. So expect a little bit of pain and try to keep your face mask on at all times. I know it's painful, but do not, in the process of expressing your pain, put others at risk. So please try to be calm. After vaccination, you will be asked to wait in a reserved area for about 15 to 30 minutes. Now, the reason why this is done is the side effects that may occur with vaccination usually occur within this time period. So when you are kept in such a place, the benefit is that if such an event occurs, you will have specialized care nearby. So please do not be upset or be in a hurry when you are told after the vaccination to wait nearby. When these events or these mild or severe side effects do not occur, you will usually be allowed to go home. So after this, please ensure to find out the dates for your next dose and how many doses the vaccine you took, contains. For some vaccines, you have single dose. Some vaccines, you have double dose. So please confirm the type of dose, the type of vaccine you took, and the number of doses if you would need to be coming back or if you need to come back for another dose. So the next set of tips is for when you get home. After taking the vaccination, some mild side effects may occur. Usually these go away within 2 or 3 days and they are not serious. Some of these side effects include things like pain at the vaccination site, heaviness of the arm, some fever, tiredness, feeling of unwellness and all that. But usually these go away in 2 to 3 days, like I said. Usually we are happy that you have this side effect because it shows that your body is building an immune response against COVID-19. So please do not be disturbed when these occur. You can take some mild paracetamol or mild analgesics to relieve some of these discomfort or the pain that you may have. And then if you find that the side effects are so serious that you cannot bear or they are worrisome, feel free to report back at where you took the vaccination from. Usually there will be a health worker who would advise you and guide you and refer if necessary. Where you have such severe pain at the arm where the vaccine was given, you can apply a cool compress, maybe something like a towel in some lukewarm water to apply at the point where you have the pain for some mild pain relief. Also remember to take lots of fluids and get a lot of rest during this time. It is important to continue to practice the non-pharmaceutical interventions of use of face masks, hand washing, sanitizer, social distancing up to 2 weeks after the second dose, because during this period your body is still building immunity against the infection or against COVID-19. However, we advise that you always have your face mask on at all times. Most importantly, this one really trended across Nigeria when vaccines came, in fact across the world. Remember to share your selfie with the vaccine card or the video of you getting the vaccine after taking the vaccine. Now, this is not just for social or photo ops or just to trend on social media. These selfies with the vaccine cards and these videos encourage people to take the vaccine. And it also shows people that everyday people like them have taken the vaccines and they are alive, especially in the light of all the false information that we have flying around. So please remember to share your experience with taking the vaccines and encourage other people to take the vaccine. The more we have persons vaccinated, the more our herd immunity will be improved or increased, and then the likelihood of transmission will also be decreased. So in this video, we have talked about tips for before going to the facility to get the COVID-19 vaccine, tips for when you get to the vaccination facility, tips for just after the vaccination, tips for what you do or when you get home, or maybe you find that you are down with some mild side effects. We talked about all these things in the video. So please do not hesitate to share your experience. I know a lot of people have taken the vaccines. I have taken the vaccines. I took the AstraZeneca vaccines when it was first ruled out, and I had similar experience. I had some of the mild side effects, but I got over them in over a period of about 2 days, and I was fine. I had fever and all that. But look at it on the bright side. Just a few days of discomfort for lifetime protection. Sounds like a good balance if you ask me. So thank you for watching this video. Once again, remember to like this video. For those who are returning subscribers, remember to subscribe if you're joining for the first time. Please share your experience with taking the vaccines. Did you get the mild side effects that I talked about in this video? If you did, tell me how you were able to surmount the discomfort in the comment section below. And please remember, once again, as always, to share this video with someone who you think will benefit from the video. Thank you so much for joining me. Once again, my name is Dr. Chandus, a public health physician practicing in Nigeria, and I'll be happy to see you in my next video. Thank you. Bye.